So I think with being able to cope, I think sometimes we tend to leave things until they get to that point where you're at breaking point and you don't know how you can go on. What strategies or tips do you have around, getting support before then, or what should we do before we reach that crisis point?
Okay, so that's a good question, Taryn. I suppose noticing a few markers or few flags that might be important to sort of be aware of before you reach that breaking point. People commenting, oh, you're being a bit short, or you're just, your temper's a bit too much, or you're a bit moody these days. They're sort of flags. The inability to sleep, staying up with the thoughts going over and over in your head, getting stuck and having thoughts going over and over in your head where they don't seem to go anywhere, you don't have a solution, and getting frustrated about that. Feeling just like life isn't worth going on with, or too much, like, you can't be bothered. There's no joy, losing the joy in your life. And sometimes people have panic attacks too, thinking even just to go to the shops, you might have a major panic attack. I mean, they're probably a bit bigger flags. But those sort of things probably should tell you, I might need to get a bit more help than I'm getting right now. And that might be in the form of seeing the psychologist, and also might be in the form of seeing a psychiatrist as well, and to manage any sort of medication that might be needed. I tend to find people with genetic conditions react to medication slightly differently to those that don't. So I think seeing a psychiatrist can be quite good, because they can sort of get the medications right for those sort of, for some conditions. And also for sleeping too, because sometimes getting sleep and mental health are very, very much connected. So sometimes you just might need a bit of help to sleep to get your mental health a bit on the sort of better track.